Weight gain is a rampant issue, and especially nowadays in India, because of the affordability and increase in paying capacity, increase in availability of food everywhere. Weight gain is one of the most common problems we notice in our medical practice. Now, there are grades of weight gain. So ideally what we do is there's something called as BMI that measures your height and weight, and we get a BMI. Anything below between 20 to 25 is considered normal. Anything between 25 to 30 is considered overweight. Above 30, 31 to 35 is considered obesity level 1. Above 40 is considered super obese. Now, in case you are obese, what is the first thing you need to do? Get your diet under control and exercise. There is no medical procedure, no any sort of thing that beats exercise and diet. These are the primary important two things. Yes, you can seek help. Obviously, before you plan for all this, rule out any medical conditions. Like ideally, meet your physician or an obesity surgeon itself to help you analyze whether your weight loss is caused due to some hormonal issues. You will have to undergo thyroid testing, hormonal testing, sugar check, all those things to analyze if there is a medical cause of weight gain. In such cases, yes, doing a treatment will also help in control of weight. Now, if everything else is good, no PCOD, no thyroid, no cholesterol issues, everything is reasonable, but still obese, start off with diet and exercise. Yes, randomly doing stuff will not. You will have to have a planned schedule of a good diet. Probably take help of a dietitian to get your diet into good control, and probably somebody into fitness. Any, it could be weight training, it could be strength training, it could be yoga, any of these to help in a good amount of weight control. Now, in case you're being doing this consistently for last 6 to 8 months and still you do not have changes in weight that is happening, you may think of undergoing some sort of a medical assistance to lose weight. Now, you have many medications in market that have come up, and they are celebrity treatments to lose weight, injectables that are taken normally on a weekly basis. These were designed to treat diabetes initially. They cause decrease in appetite. So what it does is, once you take these medications on a weekly basis, it helps in decreasing your appetite. You don't feel hungry, you don't consume much food. Again, the dosages are started at a very minimal dosage, and then it is extended over a period of time. Initially 2.5, 5 mg, 15 mg based on the medication. I'm not going to name any of these medications, but there are medications available and it's a weekly dosage. Now, you take these medications for ideally for, let's say, a period of 16 to 18 months to have a decent result of, let's say, around 14 to 15, 14 to 16% of weight loss. But you have to complement this again with diet and exercise. So you take the medications, it helps you lose a couple of kilos, couple of inches on your waistline, but you continue doing your diet and exercise. Once you stop this medication, there is a tendency for you to reboundly gain weight. Hence, doing the diet and medication will keep that also in check. So it's a good starter, but again, it's not a sustainable method of weight loss. These do have some side effects. Vomiting, dehydration are common side effects of these medications. Again, this should be taken under a supervision of a physician, a bariatric surgeon, or let's say an endocrinologist who takes these medications and the side effects, who are able to identify the side effects early. Now, next option is surgical weight loss. Now, what is surgical weight loss? Bariatric surgery or weight loss surgery. With respect to bariatric surgery, you have people who are exclusively doing bariatric surgery on a laparoscopic method. Now, bariatric surgery was previously designed to treat diabetes. So what it does is it helps in reduction of the size in the stomach, or we create a conduit or a transit where we allow the food and the digestive enzymes to meet at a later point in the intestine. Hence, the absorption of food reduces. So we are trying to help in malabsorption to lose weight. Now, the simplest bariatric surgery that is normally done is something called as a sleeve gastrectomy, where we reduce the portion of the stomach. The fundus portion or the greater curvature of the stomach is cut and the stomach is made into a smaller tube. Hence, the capacity of the stomach to expand to take in food is decreased. So, this surgery leads to decrease in capacity of food intake. Hence, it will lead to decreased consumption of food, with time decreased absorption of calories and other things, and it will lead to weight loss. This surgery is normally performed laparoscopically and it requires a couple of days of admission in your hospital. Now, next, what is another surgery available is something called as mini gastric bypass, where we create a transit, meaning your stomach acids are flowing in a different conduit, your food is flowing into a different conduit, and both of them join at a later part of the intestine. Hence, the digestive time, that is the digestive time the food is exposed to the digestive enzymes is decreased. Hence, the digestive process is dampened. This will lead to decreased amount of absorption into the intestine and passage of stools faster. So, this leads to it is a kind of a malabsorptive state. This will help in burning the fat reserve that you have already accumulated with time. This is one of the most commonly performed surgeries nowadays. Now, if you do not want the medical, you don't want the surgical treatment, there is an option somewhere in between where we introduce something called as a endoscopic or a swallowable gastric balloon, where a device, or let us say it's a large capsule that is placed within your stomach and then inflated. This leads to a physical barrier, meaning there's a physical satiety. You feel something is there in your stomach. So, the hunger is also decreased. This leads to decrease in food intake as well as decrease in absorption. Hence, the weight loss. But again, this has a limitation where the balloon stays within your stomach for only a couple of months, say between 4 to 6 months, and automatically it breaks down and passes off in your stool. So, this also is good for in case you are looking for a short-term weight loss solution, where an endoscopic or a swallowable gastric balloon is utilized. Hope this was just to give you a brief introduction into weight loss journey. Hope this was useful. Thank you for your time. Have a great day.